Hi friends, I am Dr. Swapna Chekuri from Hyderabad Women and Fertility Center. Welcome to my channel. So today let us discuss about the chance of ectopic in IVF pregnancy, because so many individuals they do ask in IVF you will definitely under ultrasound guidance you will deposit the embryos into the uterus, but how come we got an ectopic? See, always the chance of ectopic will be there. So in a normal spontaneous natural conception, chance of ectopic are almost like less than 2%. Even with IVF pregnancies the incidence is same, it's like less than 2% only. But there are few candidates where the chance of ectopic might be more. So these are all the risk factors. In whom all conditions means the patients with previous ectopic pregnancy or previous with tubal disease, or a patient who has undergone tubal recanalization, and patients who are suffering from pelvic inflammatory disease or sexually transmitted infections. These are all the candidates who are at high risk of ectopics. And then even going for multiple embryos, like instead of single embryo, some they do 2 to 3 embryo transfer at a time. So even in those cases also the chance of ectopic will be more. And patients with the fibroids or endometriosis, they are also at increased risk for ectopic pregnancy, because in these conditions uterus won't be relaxed, it will be under constant uterine contractions. Because of these contractions, when we put the embryo into the endometrium, embryo always the chances of getting skipped into the fallopian tubes will be more in case of uterine irritability. So there are certain precautions which we can take to avoid ectopic pregnancy, but in spite of taking all the precautions also still chances might be there. That's why it has come down to less than 2%. So what all precautions we can take to avoid ectopic pregnancy? So basically placing a single embryo into the uterus, definitely a single blast transfer would yield good results compared to multiple day 2 or day 3 embryos. Second thing is embryo transfer technique. See, when we are depositing the embryo into the endometrium, definitely the pressure should be constant and it should be stable. It should not be too fast also. Some people they push the embryos too fast, so that's when the embryos they tend to get escaped into the fallopian tubes. So even embryo transfer also plays a very important role to avoid ectopic pregnancy. Third thing is like patients with previous history of ectopic or previous any pelvic inflammatory disease or sexually transmitted infections. All these infections has to be cleared before going for embryo transfer. So these are all the preventive measures which we can take to avoid ectopic pregnancy. So friends, in this video we have discussed in detail what are the chance of ectopic in IVF and what are the preventive measures and who are at risk to develop ectopic pregnancy.